September is Blood Cancer Awareness Month. Blood cancer is the third leading cause of cancer deaths in the U.S., and about a third of people diagnosed with a blood cancer do not survive 5 years after their diagnosis. But it's also a type of cancer where research is leading to groundbreaking results. Here's Denver 7's Katie LaSalle.
September is Blood Cancer Awareness Month, and Dr. Michael Tees, an associate member physician at the Colorado Blood Cancer Institute, joins us now. Dr. Tees, thank you so much for taking the time to talk with us.
Of course. Thank you for having me.
It is really staggering to hear that every 3 minutes or so, someone in the U.S. is diagnosed with a blood cancer, around 10% of new cancer cases every year, and there are different types. So let's start with that. What are the various types of blood cancer?
Yeah, so there are three main types of blood cancers: leukemias, lymphomas, and multiple myeloma. Each one is unique, much like any other type of cancer diagnosis, and each one has a certain treatment strategy that is very important. Because blood cancers, as you state, aren't that common, many people aren't aware of somebody with a diagnosis of a blood cancer. And so it often leads to a lot of time that needs to be spent with the patient to understand what that diagnosis means and what the recommended treatment strategy is. Sometimes treatment isn't necessary, but many times it is.
Are there any signs or symptoms that those watching at home should look out for?
Yeah, so that's a good question. So for many cancers, there's a clear issue that can come up. A new lump or bump or mass or lesion is something that really needs to be evaluated by a physician, and that's something you don't really want to wait on. Sometimes that's not a blood cancer, sometimes that's not a lymphocytic disorder or lymphoma, but a new pain or discomfort, and excess fatigue. Those are some big ones. And maybe another one would be unexplained weight loss.
And about treatments. Now, it sounds like the treatments and transplants have evolved and improved over the years.
Yeah, oh, definitely. So at Colorado Blood Cancer Institute, we're one of the largest transplant programs in the Rocky Mountain region and also the country too. So this is what we do in other complex hematology cases. But stem cell transplant has come a very long way, and the outcomes are so much better over the past 30 plus years. But sometimes cell therapies or stem cell transplant is not the recommended treatment strategy. For example, we have new immunotherapeutic options where we're using the person's own immune system to actually fight the cancer for them. And that's actually spilling out into many blood cancers, but other cancers as well. So it's very exciting for the entire field of hematology oncology.
Dr. Michael Tees, so wonderful talking with you today. Thanks again for your time.
Thank you.
Along with the American Cancer Society and our other partners, we've put together some resources for you. If you have questions about blood cancer, you can find it on the Your Health Matters page of our webpage. That's denver7.com. There's good news in the fight against cancer. A new report shows more people in the U.S. are surviving cancer than ever before. The American Association for Cancer Research found in the past 3 years, the number of cancer survivors living in the U.S. increased by more than 1 million. As of January, there were 18 million cancer survivors in the U.S. The association said that number is expected to increase to 26 million by 2040. The overall cancer death rate, adjusted for age, also continues to drop. The report credits the decline to people smoking less and improvements in catching and treating cancer early.